Hello everyone, welcome to FriendlyRN Teach, where nursing becomes simple and friendly. Let's get into it. I hope you guys are understood what is meant by crisis. Today we are going to learn about the crisis intervention in easy way. What is meant by intervention? Through an action, the situation is improved or solve the problem is called as the intervention. We will move on to the definition of the crisis intervention. According to the Kaplan, crisis intervention is a short-term, active and directive therapy aimed at helping the individual regain equilibrium when the coping mechanism fails. According to the Kaplan, crisis intervention is nothing but quick and short help to bring a person back to normal when they feel totally overwhelmed and can't able to cope up with that situation. Next, we will move on to the goals of the crisis intervention. First one is ensure safety. It means we make sure the person is not going to harm themselves or anyone else. We will create the safe environment and stay with the client if needed. And second goal is reduce anxiety. When a person is in crisis, they are extremely scared or confused. So our job is to calm them, talk gently and help them feel stable. Third one is provide emotional support. We listen to them, allow them to cry or express their feelings and show that we are there for them in their crisis situation. Next, fourth one is promote adaptive coping. We teach better ways to handle stress instead of harmful methods like isolating themselves from the situation or getting anger about that crisis situation. We need to promote those adaptive coping mechanisms to the client. Next one is restore normal functioning. We help the person go back to their normal daily routines like eating, sleeping, working or studying, because these crises should not stop their life. So we need to restore their normal functioning in that situation. Last one is prevent long-term psychological problem. Finally, we want to stop the crisis from becoming a bigger mental health issue. With proper crisis help, we prevent depression or PTSD or long-term trauma. These are the goals of the crisis interventions. Next, we will see the techniques of a crisis intervention. Before going into these techniques of crisis intervention, first we will remember with a mnemonic, which is SCABEG, like a PSCABEG. Like you will pronounce the psychology, P is silence, right? Like that you will remember SCABEG. Okay, let's see. P for psychological first aid. Psychological first aid means giving comfort, support and practical help right after the crisis. The nurse listens to the patient calmly, gives the correct information and connects them to needed services. S for safety planning. In safety planning, we identify triggers, warning signs and make step-by-step actions the person can follow if they feel unsafe. Next, C for cognitive behavior therapy. It means changing the negative thoughts to positive realistic thoughts during the crisis. Like these cognitive behavioral therapy helps the person identify the negative thinking like I can't handling this and I can't do this, and these replace it with a healthier thoughts like I can manage step by step, I can cope up with this situation. These type of a positive thoughts will arise through this cognitive behavioral therapy technique. Next one, another C, crisis hotline. Means 24-hour phone numbers to provide immediate support during crisis. Like when a person has no one to talk to, crisis hotlines provide trained counselors who listen and support and guide them. For example, suicide prevention helpline. Counselor will listen and check the risk and guides the person to be calm in that suicidal attempt situation. Next one, active listening. Active listening means not just hearing the words but truly understand the feelings behind them. In this, we need to use the techniques like eye to eye contact, nod the head whatever they are saying, and use simple phrases like I understand, okay, go on, and don't interrupt in between when they are talking. For example, the client says that I am feeling like I am losing control. Nurse should tell that it sounds like you are overwhelmed. I am here with you to help you out through that situation. Next one is breathing exercises. Breathing exercises help slow down the heart rate, calm down the mind and bring the person back to the present. Like use the techniques 4, 7, 8. Inhale for 4 seconds, hold for 7 seconds and exhale for 8 seconds. Next one, E for establishing a supportive system. A strong supportive system makes recovery faster. Like identify supportive members like family, friends, involve them in a care plan and encourage social contact and provide community resources. For example, nurse involves the client, sister or a brother, mother to stay with them during the first few days after the crisis. Next, last one is grounding technique. What is meant by grounding technique? These grounding techniques helps the person focus on their surrounding instead of their racing thoughts. There are a few types: 5, 4, 3, 2, 1 technique. 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell and 1 thing you can taste. Through these technique you can distract from the crisis situation. You will involve in your normal functioning state, right? So remember these mnemonic: scar, beg. Through this mnemonic you can able to write the side headings in your examination. You can write easily according to those side headings. Next we will move on to the crisis intervention model. There are so many crisis intervention models. Now I will mention the Roberts 7-stage crisis intervention model, and if you stay until end of the video, I will say the mnemonic of this model. Then you can easily able to remember these Roberts 7-stage crisis intervention model. Here, first one is psychosocial assessment. Check how serious the crisis is and whether the person is at risk of suicide, self-harm or harming others. Here the nurse action is ask about the suicidal thoughts, assess the mental state, identify immediate dangers and check support system and observe the behavior and emotion of the client. Second stage is rapid establishment of rapport. It means build the trust quickly so the person feels safe to talk with you. And here the nurse action is use a calm, friendly tone with the patient and listen actively what they are saying and show the empathy and be not judgmental so that he can able to be open up with you to share their problem. The third stage is identify major problems. Here find out the real cause of the crisis. What the nurse should do: ask what happened to them and identify the triggers and separate the primary issue from secondary stressor. So you can able to give the care according to the degree of the stressor. Like first you will cure the primary stressor and you will move on to the secondary stressor. Okay, next move on to the fourth stage, which is deal with feelings and emotions. Help the person express feelings safely instead of bottling them inside. Like nurse should encourage them to express their feelings and she should validate their emotions, like reduce the guilt, shame or fear. Next, fifth stage is explore alternatives. Teach the client new coping methods or options to handle the stage. Develop an action
like
plan.
use the support
like create
system,
a simple
learning
realistic
coping
plan to
skills,
follow
problem
after the
solving.
session. Like temporary
You
solution
should
to
plan
reduce the stress.
safety planning, step to
And
solve the problem, coping
Explain
strategies,
their behavioral and
whom
cognitive
to they contact,
and
strategies.
resources like helplines, counseling, support groups. Through these you can able to help the client to regain their control. The last stage is follow up. Check whether the person is improving after the intervention. Like you need to make the differentiation before your care plan and after the care plan. These difference you will able to understand only in the follow up stage. These are the 7 stages of the Robert 7-stage crisis intervention model. Now we will see the mnemonic for this model. Make a note down this mnemonic. This is all about the crisis intervention in short way to remember before you are examining. And I hope you understand this crisis intervention. This is the 15-marker question. You let me know you in the comments. What is your pre-exam before you didn't see this video and post-exam which after you seen this video? Let me know in the comment. Thank you for watching this video till end. Please like, share and subscribe to the FriendlyRN Teach.